Hi, I'm Ros from Dementia Jersey. Today we're going to be talking to you about effective communication. So, what do we mean when we talk about communication with someone living with dementia? Communication is more than just words. It involves speaking, listening, body language, tone of voice, and facial expressions. It's how we express our needs, our emotions, and our identity. It's vital for social interaction. We all need to be heard. When dementia affects communication, it can lead to frustration, isolation, misunderstandings for both the person with dementia and those caring for them. Imagine knowing what you want to say, but then not being able to express it or being misunderstood repeatedly. This can lead to withdrawal, anxiety, or even aggression. So, how does dementia affect communication? Well, in the early stages, communication difficulties may be mild, but over time it may affect the ability to understand what's being said, to process information, to follow instructions, retain new information, express our needs, or the ability to read and write. Have you noticed any of the following when communicating with someone with dementia? Do they struggle to find the right word or use a different word instead? Do they repeat themselves or maybe ask the same questions over and over? Perhaps they lose the thread of the conversation or struggle to follow instructions. Reading or writing skills may decline over time. Sometimes non-verbal cues are affected. Maybe they misinterpret facial expressions and gestures. For example, they may take a joke literally. If the person with dementia is multilingual, they may even revert back to their first language learnt as a child. As a result of this, they may withdraw from social engagements and have increased anxiety from lack of social interaction. Communication symptoms will vary depending on the type of dementia and the area of the brain that's affected. Frontotemporal dementia affects parts of the brain that control behaviour, planning, problem solving, emotional responses, and language. For this type of dementia, language problems tend to appear first, and the person may gradually lose the meaning of words over time or have difficulties getting them out. So, how can we communicate more effectively with someone with dementia? Remember, as carers, we can adapt much more easily than the person with dementia. Some things that are worth considering to help with communications. First of all, act like a detective. Glasses. Should they be wearing glasses? Are they wearing the right glasses? Are their glasses clean? Hearing. Can they hear you properly? Are they struggling with their hearing? Are they wearing hearing aids? Are the batteries still working? Is there a lot of background noise? So, what are some tips to think about? Be patient. Give the person with dementia time to answer or time to process what you're talking about. Speak slowly, clearly, and calmly. Use simple words and short sentences, and think about the words you use. Ask simple, clear questions with few choices. Do you want tea or coffee? If this is proving difficult, then say, are you ready for a coffee? Validate their feelings. Even if their words don't make sense, the emotions behind them are very real. Support your speech with gestures or visuals. Whilst the verbal communication may become problematic, non-verbal communication abilities will often remain intact. So physical gestures, such as a hand on heart or pointing, may still be understood. Also, use visual cues to help, holding up a glass or their coat. Communicate in a calm environment. If there's a lot of background noise and distractions, this can make it more difficult for the person with dementia to understand what's going on. Be aware of your own reactions. This can affect how the person with dementia feels. Use positive body language. Maintain eye contact. Continue to talk to them, even if you don't think they understand. It may be reassuring just to hear your voice. Be aware of busy times. For example, Christmas can be a particularly challenging time for a person with dementia. Routines are changed, meal times are moved around, and there might be lots of other people and children and noise. It can be overwhelming. Use music to connect. It's immensely powerful, and singing along to an old song can help reassure and uplift someone with dementia. What if you don't know the person with dementia well and are going to be looking after them? Learn about them, gain an understanding of them and their past. What did they do for a job? Have they lived in a different country? Also, find out how to address them. Find out what they prefer to be called. Maybe they were in a position of responsibility and prefer a more formal address, Mr., Mrs., Doctor. Communication is not always easy. Let's look at an example. The person you're caring for is asking, "What time is the appointment?" But they're repeating the same question 15 times. This would test the patience of anyone. Repetition like this can be a sign of anxiety, and perhaps they just need reassurance. There is no one size fits all in these scenarios. Everyone is different. So maybe you write the time down on a piece of paper and you give it to the person. Maybe you have a whiteboard next to the clock and write it in large letters. Maybe you try and answer in as many different ways as possible. Or possibly you may need to just walk away and come back in a few minutes and they might have moved on. With patience and some strategies, you can overcome some of the communication barriers. Accept that even though the communication may change, that connection is still possible. With empathy, patience and understanding, we can continue to engage meaningfully. Hopefully, this has helped you to understand how effective communication can support a person with dementia. Don't forget, Dementia Jersey is here to support you.